Hi, I'm Arena, and I'm the pharmacist at the Organic Compounding Pharmacy. Today, we're discussing a nutrient that's essential yet often overlooked: vitamin D. What is vitamin D? Vitamin D is a fat soluble vitamin that our bodies make through sunlight exposure. However, factors like limited sun, indoor lifestyles, living in northern regions, or seasonal changes such as the winter season mean many people are deficient, making supplementation necessary for many. Signs of vitamin D deficiency include persistent fatigue and tiredness, bone pain and weakness, muscle weakness, and mood change. Vitamin D helps the body absorb calcium, which is essential for strong bones. Without enough vitamin D, bones weaken, increasing the risk of fractures and osteoporosis. Research from the National Institutes of Health shows that adequate vitamin D intake improves bone density, particularly in older adults and postmenopausal women. Vitamin D also helps support the immune system. Studies, like one published in JAMA Network Open in 2020, show that vitamin D helps reduce the risk of respiratory infections by regulating the immune system. Low levels are linked to a higher susceptibility to colds, flu, and other respiratory issues. Vitamin D also helps support hormone regulation. Vitamin D plays a key role in hormone regulation by supporting the production and balance of essential hormones like testosterone, estrogen, and progesterone. Its receptors are found in hormone-producing tissues, indicating that it influences these hormonal pathways directly. Research published in Hormone and Metabolic Research has shown that adequate vitamin D levels can boost testosterone, and other studies have linked vitamin D to improved ovarian function, helping regulate estrogen and progesterone, particularly in women with hormonal disorders like PCOS. By supporting these pathways, vitamin D contributes to broader hormonal balance and overall health. Vitamin D also helps with mental health and mood regulation. Low vitamin D levels have been associated with mood disorders, especially depression. Research in Nutrients in 2020 highlighted that adequate vitamin D levels can improve mood and support mental health, as vitamin D receptors are found in the brain. Vitamin D also helps with chronic disease prevention. Vitamin D has been linked to a lower risk of certain chronic diseases. A 2014 study in BMJ found that adequate levels may reduce the risk of heart disease and certain cancers. The recommended dietary allowance for adults is 600 to 800 IU daily. However, for those with limited sun exposure, many experts recommend 800 to 1000 IU daily. For deficiency, higher doses, around 2000 to 4000 IU daily, may be more effective, according to research in the American Journal of Clinical Nutrition. The tolerable upper intake level is 4000 IU per day, but doses up to 10,000 IU have been shown to be safe in some studies. Always consult your healthcare provider before taking higher doses. Vitamin D is essential for children's bone development. For infants, 0 to 12 months. The recommended dietary allowance is 400 IU daily. Exclusively breastfed infants may need supplementation, as breast milk often doesn't provide enough. For children 1 to 18 years, the recommended dietary allowance is 600 to 1000 IU daily. The best way to check your vitamin D status is through a blood test. Optimal levels are typically between 75 to 125 nanomole per liter. If you're below this range, work with a healthcare provider to determine the right supplementation plan for you. In summary, vitamin D is vital for health at every age. A daily intake of 800 to 2000 IU is generally safe and beneficial, especially when sun exposure is limited. Always consult your healthcare provider before making changes, particularly if you're considering higher doses. Thanks for watching and stay healthy.